Okay. So today we're talking about understanding the development of social and community welfare provision. Uh, I just have a question. Can everyone see my screen? Can everyone hear me? Okay.
Yes, please.
Yeah, thank you. Any point in time, my slides are not visible, my sound is not audible, please let me know. I'd really appreciate that. So we're talking about understanding the development of social and community welfare provision. So this is our last learning outcome that we are covering today. And then later on, we'll talk about what we had discussed yesterday. So the four important reports related to the social and community welfare provision. So what are they? They're the beverage report. This is from 1948. The Griffiths report, which came out in 1986, Lord Derzai report, which came out in 2008, and Marmot review, which came out in 2010. There are several other reports, but the most important ones with relation to community welfare provision, social and community welfare provision are these four ones. Can anyone tell me what does this mean? I'm not sure if you've gone through this this picture before, but what does this show? So this actually shows our system as a whole. So if you see, I'll resume my slides. Okay, so if you see this whole picture shows it's a framework for assessing and addressing health inequalities. So we've talked about health inequalities in a bit about them. So what they were, we talked about what are the factors that impact health provision. So there was some factors that you can't change, like age, sex, and some constitutional factors. There's some individual lifestyle factors that influence your health. Then there are certain social and community networks that have an impact on your health and well-being. And on top of those, there's agriculture, food production, education, work environment, living and working conditions, unemployment, water and sanitation, healthcare services, and housing. All of these have an impact on your health and well-being. And then there's this comes under the umbrella of general socio-economic cultural and environmental conditions. So all of these have an impact on your health and well-being. Social and as which includes your age, your sex, and constitutional factors. So all of these will have an impact on your health. So it is important to understand these when we are talking about health. So health obviously is impacted by a number of factors. Some of these have been mentioned here in this report. So some of the key terminology. So what is welfare provision of community care and health social work? Can everyone see the slide number 3 on my screen? Can you see them on your screen? Slide
No.
number 3. Okay, you can't see it. That is what I was concerned about. Okay. Can you see this now? Key terminologies?
No, please.
Yeah, thank you. Okay, so welfare provision, we are talking about several concepts related to welfare provision. So, the welfare state, so in Britain, it's known when it was formed in the 20th century. But if you see way beyond that, before that, you can have it in the very medieval times as well. You can have traces of it. So welfare was delivered as a whole, free of the state. There were many local churches that ran hospitals in today's terms. So there was a different concept of hospitals compared to now what we have as hospitals. So in the past, these places were community. They were not well. They were looked after. And even before that, in 1598, if there was a poor family, it was the responsibility of everyone to take care of that poor family. It was known as the Elizabethan Poor Law, which was an act that was passed by Elizabeth I, and it offered the poor some protection. There were less sturdy beggars who were sent back to the parish of origin for help. And there were people appointed to oversee the poor, and they had to develop houses for them. So there was a lot of support, finding work for the unemployed. This was all during the 1598. So the welfare state, if we call it a welfare state, it's not just now, it's way back in time. And then came the Industrial Revolution. A rapid population growth because there were more people coming in. There were development of towns, and then there was experience of modern unemployment, and there was increasing poor rates. So in 1833, there was Earl Grey Prime Minister at that time, who set up a Poor Law Commission. And this was to see to see how many people were needy at that time, really needy. And there was a poor law system that had to be put in place in Britain. A report was published in the year 1834, and there were several recommendations made to the Parliament. And then there was the Poor Law Amendment Act, which was passed. And then we have certain theories. So why are we talking about these acts and these theories? Because we are talking about social and welfare and health. So whenever we are talking about social and community welfare, we need to know where its origins were from. We've talked about ethics yesterday. So now we need to know, where did it all start? So there were certain theories in social policy, and those talked about welfare provision, and also to the extent to which these theories influenced the delivery of welfare services, and also meeting the demand. So there was a change in society. There was a the industrial revolutionism, or industrial revolutionary time, during which there were more people coming in, more influx of people, and poor were increasing. The poor laws were very much disliked. So there's opposition everywhere. And a great deal of development of social services in the 20th century meant tests, healthcare, and national insurance were designed to avoid having to rely on them. And there were a lot of industrialized societies where there was social exclusion and poverty that was alleviated to some degree by introduction of a welfare state. So a welfare state was renewed There were a lot of changes in national insurance and healthcare. These were all there to support in making this a proper welfare state. There are a lot of industrialized and industrializing countries in the world that are welfare states, which means that the state plays a central role. And what does it play a central role for? It's the provision of welfare. That means health, that means income, that means housing, education, um, to meet the basic needs. So everyone is at one level, basically. So what's a welfare state got to do? It's very important that it. So when you're working for a welfare state, you need to see the number of jobs that people lose. You need to see people who are of old ages because they're more vulnerable. You need to see sickness. You need to see people who have disabilities, the level of welfare services and spending. These all vary from country to country. You cannot say that America, if there's it develops into a welfare state, it would have exactly the same. No, the demography is different. The pull and push factors in America, they might be very different compared to those in the UK. So there are a number of countries that there's a budget that is being given to them, and there are a lot of theories that have been developed and political views, and these have all been either divided into the right and left wing views over the welfare state, and there's some the policies that have been shaped after this welfare state today also. Anyone wants to add to this information, you're free to do that. Some people might know better than me regarding the history and the British history. So I'm happy to take any comments or any views from your side. So there was the right wing, which we said it's against public provision of welfare and and they're seen as individualist. On the other hand, the left wing, if you see, is for public provision of welfare and residual welfare, and they're seen as collectivist. So there's the right wing, which is the individualist, the left wing, which is collectivist. But this is not very straightforward. So there are positions that might be held by people. There is an individualist left wing and a collectivist right wing as well. So many right-wingers accept the principle of institutional welfare, and many left-wingers are uncomfortable about institutional measures. So they're all sometimes for each other and sometimes against each other. So there's student grants or earnings that are related or related pensions, which favor the richer people over poorer ones. Left-wingers, however, support social security. This enables people to buy food in the private market rather than soup kitchens. So there's a mix of debate. So, and then the main political perspective of welfare positions, what are they? There's the Marxist, there's the conservatism, and the liberal individualism. There's what does the Marxists say? Their core beliefs are that welfare concentrates basically on its relationship to the exercise of poor. So they're Marxists that argue about welfare that has been developed through the strength of the working class resistance to exploitation. And they further argue that the state can be seen as an instrument of a complex set of systems, and this reflects the contradictions of the society. And they also see it as a ruling capitalist class, or at least a part of it. So the Marxists think that welfare concentrates on its relationship to the exercise of power. So there's all power related to it. And it's this strength of the working class resistance, which develops the state. The conservatism, you have conservatives core beliefs that lie in the importance of social order. So they focus more on, in their respect for tradition, there's a lot of focus on religion. This is based on class or on caste. So conservatives believe that welfare is a secondary issue and the basis for structured social relationships. And then you have the liberalism. This believes that the premise that everyone is an individual and the individuals have their own rights. They mistrust the state and they also believe that society is likely to regulate itself if the state interference is removed. So liberalism is in removing interference of the state completely. Liberalism is a central core belief. So their central core belief is freedom. All freedoms are not equally important, they say. And main values and certain freedoms like freedom of worship, speech, and of sorry, I had a bit of cough. So talking about the welfare state, um, does anyone know what we're talking about actually? Are you understanding what I'm talking? It's a lot of history. So more than understanding it, you would want to know actually what happened at that time. How did this whole health and well-being get into its like it wasn't like this before. So what were the ways in which it's been its evolution actually? So the welfare state, it stretched further under the pre First World War, and there was a liberal government's principles that emerged as that the state would eliminate the worst causes of poverty, and the state would also introduce education, pensions, unemployment insurance, and minimum wage boards. Other measures were also very strict. These minimum standards, so there were certain minimum standards that were set. These were introduced to give a basic level of assistance. So you can't assist everyone. So there'll be a cut off where you have to assess people, and then below that cutoff, obviously, that is where you will give your assistance. This is to prevent this destitution and to deal with poverty. Then there was the first National Health Insurance Act. Okay, where were we? Sorry for that. Can everyone see my screen? When this Health Insurance Act was passed, working class. But after World War One, it was it wasn't that great, what it was expecting. Thank you, Esperance. Um, and then in 1917, Lloyd George, he was a prime minister at that time, he warned that there was a Russian Revolution which had already inspired workers across Europe. So he argued that the working class will be expected a really new world. They will never go back to where they were before the war. He promised a land fit for heroes. He was hoping to convince workers that life would improve without them following their Russian cousins. If we see, there's a lot of debate about this. So there's a lot where you see that different people having different needs. So there's the blind, the deaf, the long-term sick, and the handicapped. There's single parent families, unmarried mothers, and newly arrived immigrants. Although the principle of a national minimum standard of life still in place, it has immensely improved in comparison over the last 90 years, and this is efforts being. And then in there was the Bitry, where we have the beverage report. We've talked about uh, in a nutshell, if you see, there's a lot of reports that tell you about what happened. So this is the beverage report in 1942, which talked about uh, the welfare state again, a reformed welfare state. Uh, you had the Educational Act in 1944. So these are all there if you want to write them there in your assignment. So you had the welfare report in 1944, which provided free secondary education for all children. The Family Allowance Act 1945, which showed universal benefits for families with two or more children. National Health Service Act 19 having issues with my internet. This happens when there's a lot of rain. Uh, okay, so my question was from you. Why are we talking about this? Any idea? And where are we? What is our direction, basically? If we're talking about all of these um, welfare acts, what is our main objective here? Do you recall what we had for our assignment when we were discussing a bit about our assignments, if any one of you was there? So we talked about different reports. We're talking about different reports. So the reason why we're talking about these different reports is that we need to understand where did it all start from. That is why we're talking about them. And if we do not know about where it all started from. So we have the National Insurance Act, for instance. So has it brought any change since the beginning of times? So we have the Children Act 1946. We have an act for those who are disabled or those who require more support, the vulnerable. If there is a welfare state, definitely. But what is this welfare state adding to your well-being? This is why we're talking about it. So this beverage social insurance proposal, it had forms. So there was a fixed amount for individuals with additions made for dependents. So you had more influx of people, and this is how you were supporting them in a better way. So obviously, people did not come alone. They had children. Most of them had larger families. So this is how the UK supported and provided them welfare. So what about health? So we've talked about health, welfare. Now what about health? So there was the National Health Services, which started the National Health Service Act in 1946. You had the NHS, and you've, we've talked about all the principles and the core values of NHS in our previous session. So there were doctors who believed that they would treat fewer private patients, and the outcome meant they would lose out financially. So I'm not sure this is this problem before, and I'm sorry for this. How the privatized NHS became more government funded, and it's through the taxes that it where all the funding comes from. So a bit about the 1970s, when there was the best way um, how how to minimize those people who are who struggle to get to hospitals, or who cannot pay for their own. So there was this the NHS that slowly changed its mindset. So it was seeing, it was increasing its trust. So there were 57 NHS trusts that came into being from 1991 to 1995. And there was a lot of GP funding that was increased. The NHS became a provider, amongst others, other welfare, way ahead of what it was expected to being in the 1950s and 1960s as a result of मैं राउटर ले रही हूँ आज जाके Okay, so I should have my screen again. So what happened during this time? There was a lot of mental stress. Obviously, people were having to lose their jobs. They did not have enough to pay for their own health. So, and obviously, seeing private psychiatrists was not obviously not possible for everyone. So there was the rich and the poor. Obviously, the rich had more a better experience everywhere compared to the poor. There were psychiatrists that were questioned regarding their traditional treatments for illnesses. So there was a lot of revolution that was made, and this then brought into the Mental Health Act 1983 that set out rights of people that were admitted to mental hospitals, and the introduction of legislation that gave the mentally ill more rights, allowing them to appeal against any injustices that were happening. Then we had in 1984, we had Sir Roy Griffith's report, and this led into the inquiry into community care. And there was a lot happening at that time. And then there was the Community Care Act of 1990, which was a major legislation. So what actually happened here was that obviously there was a lot of mental stresses, mental health issues. They were rising as there was no stop to them. But at the same time, what happened was a new revolution which said that the old drugs that were given to the patient changed. These were there were new modern mental health services that came up. There was the NHS Direct helpline access that gave 24-hour crisis teams that exists today as well. There were New Horizons, which was a shared vision for mental health, and it's a comprehensive initiative that was delivered by 10 national government departments. So mental well-being was then aligned with physical well-being. It was not just physical health that was being seen as a meaning to health. This is a timeline that I would want you to go. So we've talked about most of these. This is from 1948 to 2006, which shows you the key milestones that have been there when we've had social and community welfare provision throughout the years. This is all that we've talked about already. Milestones in throughout UK's history. Some of them are the Elizabeth Poor Law. We've talked about this. The National Health Service Act. This was an act by the Parliament that established national health services in the UK, which provides free healthcare to all residents of the UK. It's funded through general taxation. The Beveridge Report we've talked about already. Disability Act 1995, which was an act of Parliament that outlawed discrimination against people with disabilities in the UK. The act requires employers, service providers, and others service providers, we're all service providers in a way, and others to make reasonable adjustments to accommodate people with disabilities. Then you had the Human Rights Act 1998. This was an act of parliament which incorporated the European Convention on Human Rights into the UK law. The CARE Act in 2014. So if you access these acts, these laws, these are very important. One of these slides you could use for your assignment actually. There was an act of the parliament that reformed the social care system in the UK. This act introduced new protections for vulnerable adults to prevent abuse of theirs, to prevent their neglect, and it established a cap on the amount that people have to pay for their care. And then we're trying to compare and contrast. This is also one of your assignments, current health service provision with preceding health care services. So if you see financing before, it was preceding the health care services. It was paid for by individuals, charities, or religious organizations. But in the current system, it's funded by general taxation, with a portion of the funding coming from our national insurance contributions. Talking about access to care, it was limited in access for the poor and working class, but now there's universal access to all residents within the UK. Then talking about the range of services, there was a limited range of healthcare services before, and little emphasis was given on preventive care, especially mental health. Now there is comprehensive range of healthcare services, including preventive care, mental health services, and palliative care. The quality of care was variable before, but now this is high quality standards which are developed by Care Quality Commission, CQC. Patients had limited choices before with regards to their healthcare providers and treatments, but now they have more choice. They've been given more independence over their decisions. Technology was limited before, and now there's high reliance on technology with regards to all the processes within the healthcare. There was limited collaboration before, but there's been greater now with time. I'll skip the slide. So overall, the current healths are equitable and technologically advanced. The NHS has been successful in providing universal access to healthcare, promoting preventive care, and ensuring high quality care for all UK residents. But still, there are certain challenges that are as a result of rising healthcare costs, growing demands for healthcare services, and there's a need to address these health inequalities. Um, I will stop the recording. So, does anyone have any questions from this